My name is Dr. Jacqueline Kitulu. I'm a general practitioner for the last 24 years. I have today partnered with Ponea Health on this educational video on diabetes mellitus. So what is diabetes? So diabetes is a metabolic disease. Diabetes is a disease that involves your metabolism of glucose. So it appears in two forms, and when you hear of it, you'll hear perhaps conversations around diabetes type 1 and about diabetes type 2. So diabetes type 1 is the form of diabetes that usually starts in infancy or childhood, and it's where there is an insufficiency in a hormone called insulin. Insulin is produced in the pancreas, and an organ that is within the abdomen. So that insulin in a type 1 diabetic is actually insufficient. So the pancreatic cells do not make the insulin. And therefore, these type 1 diabetic patients essentially will require insulin on a daily basis. Now, the type 2 diabetes is slightly different. So they don't have a total insufficiency of the insulin, but they have reduced insulin production. So a lot of their treatment is geared around trying to increase sensitivity to that insulin, or even trying to increase production of what is there within the pancreatic cells. Now, the issue around insulin production is that when you eat, whatever food you eat, it's broken down into its most basic form, which is glucose. Now, for the glucose to move from the blood circulation into the organs where it's needed, so like into the brain, into the muscles, into all the other parts, it requires insulin to move it to those areas. So when there is low insulin or no insulin, then the blood sugar just remains high in circulation. And that is why many of the times when you hear diabetes, in many languages, they'll call it sugar or they'll call it sukari, because indeed, when we do measure the blood sugar, then you find that the blood sugar is quite elevated. When we're talking about elevation, what do we mean? There's a normal range. That a normal range of blood sugar will be, if you have not eaten, if you have what we call a fasting glucose, should be under 5 or under 6 if we are being generous. But a blood sugar, a fasting blood sugar that's above 7.8 millimoles, that's the unit we use, that and on repeated occasions, more than 2 occasions, confirms diabetes. Alternatively, we can still look at the blood sugar after you've eaten. So we would expect, of course, that after you've eaten, you have sugar in circulation. There is a certain level to which it will go. So a random sugar, that's a sugar after you've eaten, should be less than 7. However, for a diagnosis of diabetes, that random blood sugar would have to be above 11.1. And usually we'll measure your blood sugars twice at least to be certain that it is a sustained elevated level of blood sugar. So in simple terms, that is what diabetes is. It's an elevated blood sugar resulting in a chronic illness that we refer to as diabetes mellitus. So thank you very much for having joined in this series, listening to hypertension and diabetes. It has been my pleasure empowering you to manage your hypertension or diabetes at home. You can reach me through ponea.com for my services for managing your hypertension or diabetes. Karibu.